This is Radio Brockley.
Hello and welcome to Brockley News, Radio Brockley's weekly show, keeping you up to date with all you need to know about what's happening in and around the hospital. I'm Alan Joyce, and coming up tonight we'll be hearing about the RNOH's Director of Nursing, Paul Fish. He'll be here in the studio telling us all about his role in the hospital and how he has an influence on the work and training of your nurses in this hospital. He'll be telling us a lot more about that over the next half an hour. Then at 7:30, your chance to win some Radio Brockley goodies without leaving your bed on Bedside Bingo. David Rauch is here in the hot seat giving you the chance to win some goodies, and the patient reps will be up with you very shortly. And at 8 o'clock tonight, it's all your choice of tunes on the Sunday Request Show with Emily Colebrook. So stay tuned to London's official #1 hospital radio station, your #1 recuperation station, Radio Brockley. So Paul Fish is the Director of Nursing here at the hospital, and he's very kindly taken some time out of his busy schedule to tell us more about his work around the RNOH. Asking the questions is our reporter Jack Andrew.
Welcome. At the moment in the studio is Paul Fish, who is the Director of Nursing, Quality and Patient Experience here at the hospital. Basically, could you just outline sort of what your job is in general here at the hospital?
Yeah, well, it contains a few elements really. So I'm the professional lead for nursing in the organisation. So that means that I set standards around nursing practice. I set the strategy for how nursing practice will develop, and then I provide leadership for the profession and make sure that those things around standards and the strategy are delivered.
But your background is obviously in nursing. What actually made you think nursing is the job for me?
Yeah, so my aunt's a nurse, and I remember from a very young age going to visit my nan who lived up in the northeast. And my aunt would come home as a district nurse and have lunch with my nan, and she'd come in her uniform and she'd talk about care that she delivered to patients, and it always seemed really, really exciting. And she kind of cottoned on from a very early age that I was interested in nursing and would be really encouraging about the profession and that I should join it. And she ended up being a great inspiration. So from a very, very young age of watching her and listening about the career she had, it got me excited about going into the profession.
And being a mere male,
so it's not so much of an issue now as it has been historically in the past. But there certainly have been some times in my career in my early career where patients weren't comfortable being cared for by a male nurse, and that's absolutely fine. And we would find a female nurse who could provide that care. But on the whole, patients are comfortable with it.
So your background at school, was there any specific subjects that you wanted to pursue so that would fit into your career, your goal, what you really wanted to do in nursing?
Yeah, well, nursing's very much an art and a science, and so I did all of the sciences, biology, chemistry, physics, etc. But nursing practice itself is very much an art as well. You know, it's about the social sciences, understanding patient psychology and the social interactions. So it's, as I say, it's both an art and a science.
I think we'll come on to maybe a little bit about that later on, if that's possible. But really, you've chosen nursing, but your current job is just a little bit more than nursing. Could you just tell us a little bit more about what you do in especially your quality and the experience that you're passing on to the nursing staff at the hospital at the moment?
Yeah, so quality is kind of core to the Director of Nursing's role, and I suppose that's about having systems in place that tell us, do we deliver great care on a day-to-day basis? So measuring particular metrics that we know tell us that good care is being delivered, so how patients tell us that we're delivering good care, whether they've had any pressure ulcers whilst they've been in hospital, whether there's been any falls, whether staff tell us that they're able to deliver good care, what our staffing numbers are like. So identifying the kind of things that tell us whether good quality care is being delivered, measuring those, and where we see that there are things that we could improve, having a plan in place to improve those things and seeing that plan through.
So what keeps you going?
Yeah, so I think it's about seeing improvement in care for patients. And that's what drives all nurses, really. I think, delivering good care for patients. The thing that drives that for me, for my particular job, is having wider spheres of influence in order to be able to do that. So the nurse who's delivering care at the bedside might well be motivated very much about delivering great care for that individual patient and doing a great job and having good outcomes. One of the things that drives me is being able to do that for much larger groups of patients and having systems and processes in place and developing staff so that care for patients across the whole organisation can be good.
So if you're monitoring the quality, and obviously the staff are aware of that, the nursing staff, how do the staff actually get their motivation from everything that you put into the whole role of the nurse?
Yeah. I think the majority of the staff get motivation from the actual care that they deliver and the feedback and the relationship they have with their patient. I think on the whole, that's what motivates the vast majority of nurses. But there is also something to be said about how, as an organisation, we recognise the great care that nurses give. We do that obviously formally through the annual staff awards, which is a great place to recognise people's achievements. But something else that we've just actually finished doing is nominating a number of our nurses for some national nursing awards. So the Nursing Times Awards, it's the Golden Globes of the nursing profession, with a big black tie event at the end of it, and everybody is very keen to kind of win those. And I'm really, really pleased and proud to say that we've nominated a number of people this year for those national awards for categories like Nurse of the Year and infection control practice and improving patient safety.
The actual job of the nurse, if I was thinking of a nurse, I would just think of, this is the person who's going to look after me when I'm in hospital. And of course there's different sorts of hospitals, and you've been through yourself into being the registered nurse, and then you were in intensive care. So there's intensive care nurse and yourself, resuscitation. They're all specialist areas. So a nurse perhaps just isn't a nurse.
Yeah, no, absolutely. I think that's one of the things that brings many people into the profession. People can work in hospital settings, in community and into patients' own homes, in primary care. They can work doing aeromedical evacuation in planes and helicopters. They can work on ships. They can work in industry, in occupational health. They can work with all kinds of specialities, so cardiology, orthopaedics, etc. The number of career options is limitless, really, and people can specialise in clinical practice and delivering care to patients directly, or they might be interested in research and education and teaching in universities, or leadership in being matrons and directors of nursing. That there's just so much opportunity for people that want to have a variety in their career if they come into nursing.
So if a nurse came into the profession, he or she would actually be aware of these opportunities. Is that part of the nursing programme, now talking about the actual profession, as opposed to what they actually do on the wards, etc., which we'll come on to in a moment?
So in terms of the nursing programme, all nurses now are degree educated, so their education is in a university which is linked with a number of NHS hospitals, and they come out at the end of that with either a bachelor's degree in nursing, or some of them come out with master's degrees in nursing. And throughout their programme they have an academic component in the university where they're learning anatomy and physiology in theory, and they're undertaking assessments and assignments and exams. And then at least half of their programme is in practice in hospitals, and they rotate around a number of different wards regularly where they get the opportunity to see what it's like caring for a patient with an orthopaedic issue, a patient in the accident and emergency department, a patient in intensive care. And throughout that time they get to see where they might want to specialise in their career. My experience is that most people, when they qualify though, will then also spend a few years working in different areas in order to find out where they want to spend the majority of their career.
So being in the orthopaedic hospital, what special things does a nurse in the orthopaedic hospital perhaps need to have and to deploy in order to work in this environment?
Yeah. So I think there are some core skills that every nurse in every environment, no matter where they are, has to have. being caring, compassionate, empathetic with patients. No matter where you are, nurses have to have those, and I think the nurses that we have here at the RNOH have those skills in absolute abundance. They're excellent, caring, compassionate nurses that we have here. But clearly in a hospital like the RNOH, where patients with the most complex orthopaedic problems come to receive care, our nurses have to have a particular level of knowledge and skill around caring for those patients that nurses in more local hospitals just wouldn't have. So it's about those very, very specialist skills and knowledge on top of their basic nursing skills.
This is Brockley News, and don't forget, still to come this evening, we've got Bedside Bingo coming up in just about 15 minutes from now. Your chance to win some goodies, so good luck if you're playing along. And if you don't win, then you can always get a request on in the following hour between 8 and 9. It's the Sunday Request Show. Emily Colebrook in the hot seat tonight, introducing all your favourites. In the meantime, let's rejoin our reporter Jack Andrews speaking to the Director of Nursing, Paul Fish.
So we brought you in here for a little bit of a chat, and that's wonderful just what you're outlining as to what happens here in the hospital and in general for the other hospitals, of course, as well. But could you just talk me through what you're perhaps going to be doing for the rest of the day, and the fact that you've given up half an hour, thank you very much for this interview, but the rest of your day, what do you actually do?
That's a great question. So I'm still relatively new in the organisation. I started in February, so it's just a few months in for me. I spend a lot of my time meeting with people and discussing issues and assessing situations, and that's through one-to-one meetings with individuals, wider meetings, being on wards and departments, talking with staff, talking with patients, and having an overview of what's going on in the organisation and getting that sense of whether there are things that I need to help with, what the quality of care is like in the organisation. So for the rest of today, for example, in various settings, either in the hospital or in my office or in various meeting rooms, I'm meeting probably with 20, 30, 40 more people today to talk about various different quality and patient issues in the organisation, and assess situations, come up with plans, set direction, provide leadership for particular issues.
How does this feed down to the actual patient?
Well, I hope that that's seen by the patient in the care that they receive. So I suppose I go out and about and I meet patients and will introduce myself to patients. But I suppose if I'm really doing my job effectively, they should see that care's being delivered in the one-to-one interactions they're having with the nurse that's providing care with them on the ward. They'll know that there are enough nurses there to provide that care for them, that the nurses are meeting their needs, that the facilities are right to meet their needs, that we're not harming patients in any kind of way, and that when they leave the hospital, we've given them such a good experience that they would recommend us to friends and family to come if they needed treatment.
How do you find the nurses to actually come in and to work in this hospital, the orthopaedic hospital? Are they specifically trained, or do they come in and do you train them in the hospital?
So we've got a variety. So we have some of the most specialist, experienced, qualified orthopaedic nurses in the NHS working in this trust, and they've had a whole career at the RNOH. And then when we have vacancies, sometimes we appoint into those vacancies from equally experienced nurses that have been around the NHS elsewhere. But it's also important for us to be able to grow our own, if you like, and develop the next generation of expert orthopaedic nurses. So we're just as open to nurses at the very beginning of their career who've just graduated from university, who want their first job and know they want orthopaedics as a career choice. We're just as welcome to them to come and have their first job here, and we'll develop them into that expert orthopaedic nurse.
You've been very modest. 98.4% of your shifts are filled. Now that's got to be a huge percentage. I don't know the difference between other hospitals, but you must be very proud of that.
Yeah, so this is about, for people who are not familiar with this is about the number of nurses that we have on duty, and it's a very important indicator. We know that patients get better care, there's less harm whenever the right number of nurses are on duty, and so this is a national mandated measure of how good hospitals are at providing quality care. and we consistently have the right number of nurses on our wards and departments, and I think you can see that through the outcomes that our patients have when they come here, the experience that they have and the feedback they give us about the care they have.
The patient safety is obviously very, very important. Do you find that there's more emphasis on patient safety in an orthopaedic hospital?
I think the emphasis on patient safety in the NHS as a whole has gone up dramatically over the last decade, and rightly so. Patients should be safe whenever they come into hospital, and that's about identifying where things have gone wrong, and things do go wrong in every single NHS organisation. It's about recognising where that's happened, learning from it, and then trying to design systems in the future that mean that that same kind of harm can't occur again. And throughout that whole process, it's about being honest with patients who are involved in that harm, that something's gone wrong and this is what we're doing to learn from it and prevent it from happening again.
But with that as well, how do you maintain the morale?
Well, I think it would be very difficult for individuals if we operated that safety improvement process I just described before. I think that would be very difficult if we operated in a culture of blame, where individuals were blamed when something went wrong. What we do is, where something hasn't gone the way it should have gone, we identify that and we learn from it, and people don't feel like they're being blamed.
Back to being here in the studio of Radio Brockley. Got to get my plug in here as well. Yes. How do you think that hospital radio, and especially Radio Brockley, actually helps in any way with the patient experience, their feeling about everything that's happening when they're there in the wards?
I should congratulate Radio Brockley actually for your recent prize win. I should say further prize win. It's a great accolade for the radio station, so congratulations and well done. I think there's a couple of things. There's a lot of evidence about the impact that music has on patients and healing. So there's something just about a space where patients can put their headphones on, close their eyes, and go into another world and listen to some music. But I think the other issue is that even with the best will in the world, being in a hospital bed for a long period of time, if you're in bed for a number of weeks, can be quite a boring place to be. And the hospital radio is absolutely some entertainment, some distraction, a place for people to go and break that monotony of a ward routine. So I think for patients' experience, it's a very, very important resource that we've got.
So is there anything else outside any interests that you particularly have, apart from you're absolutely enthusiastic about this? Do you have any time? And when you do have that time, what do you do?
Yeah, so outside of work, I think there's probably a couple of things really. So I'm relatively new to London. I say relatively new, it's 2 years, but it's a big city, and so quite a lot of my spare time is still exploring London and kind of getting around and still very much enjoying that. And then the other thing is probably something which is quite different, and that's that I'm learning to fly. So I'm a frustrated pilot, and I'm currently doing my private pilot's microlight licence, and it's great fun.
Where do you fly out of?
So I'm transferring. So I used to fly out of a small old World War II airfield in the northeast, and I'm did kind of the first part of my licence up there, and I'm looking for a place down in London at the minute. I've got a couple that I need to explore a bit more. Or
perhaps Elstree, and we can all wave to you from
our
ward beds. There goes Paul. Hello, Paul.
Absolutely.
Now, if anybody, again, talking about the patients and everything that we've covered here, if there was either a youngster in maybe the adolescent ward, or maybe somebody in one of the other wards who are changing careers, or a youngster wanting to come into nursing, what advice would you give them?
Absolutely do it. The variety that you can have in your career is amazing. You can travel the world if you want to, you can work in all sorts of specialities, and you can make a very, very big difference to the many thousands of patients that you'll care for over the period of your career. Take charge of your development. If you, when you first qualify, I would say 3 things to newly qualified nurses. Take charge of your professional development. Don't wait for others to do it for you. Use the best evidence you can to guide how you care for patients, and have fun.
Lovely advice. Now, you've got a 3-year plan, I see, from the hospital magazine there. Do you want to just briefly, in the next sort of 3 minutes, do your three-year plan?
Yeah. So we're developing that currently with the wider nursing profession and others within the organisation, other stakeholders, including some patient representatives. And it contains a number of different strands, but I think one of the bits that I'll focus on to just give you an overview here is the research and education development that I would like to see. So we're going to establish something called the Centre for Orthopaedic Nursing Research and Education, which will be the first centre of its kind in the country, and it will become the leading academic centre for the development of orthopaedic nursing. And what that centre will do is provide post-registration, postgraduate training for nurses in a way that we want nurses from all over the country to say, I want to be an orthopaedic nurse, and therefore the only place for me to go to do that course is the RNOH, because that's the place you go to learn to be an orthopaedic nurse. So that will be the kind of education part of it, and the research part will be research that's generated that has an impact on how orthopaedic care is delivered across the NHS. So we're the National Centre for Orthopaedics, and therefore there's a responsibility for us as nurses to change practice, not just here in the organisation, but across the whole of the UK. And this centre, which is a collaboration between us and London South Bank University, will provide the research to change that practice and the education development for the future orthopaedic expert nurses.
Paul Fish, Director of Nursing, thank you very much for sharing all of your thoughts with us.
Paul Fish, the Director of Nursing, a big thanks to him for coming down to the studio. If you want to hear that interview again, we'll put it up on our YouTube channel very shortly. You can go to youtube.com/Radio Brockley to catch up on previous editions of Brockley News. And coming up over the next coming weeks, we've got interviews with the Aspire Centre about their wheelchair rugby club, at the Disability Foundation with their Therapy of the Month. We'll be finding out about the Buttercup Walk here in the hospital, and also the SCAT Bone Cancer Trust cycle ride as well. Coming up next on Radio Brockley, it's Bedside Bingo, your chance to win some Radio Brockley goodies with David Rauch, and at 8 o'clock tonight, all your favourites on the Sunday Request Show with Emily Colebrook. Brockley News returns at the same time next week. From me, Alan Joyce, though. Good night.